So DataHaven's an organization. It's been around about 25 years in New Haven, and we serve communities around Connecticut now. We have a board of directors that's based of like institutions around the city and other cities nearby. And our goal is to help facilitate data collection, data sharing, and help communities use data. So we do our own surveys, like in cases where there's not existing data. We do a lot of surveys. We then use that data and write reports, either our own reports, or we sort of bring organizations together to collaborate on larger reports. So instead of them all sort of working on their own projects about a city, they sort of we bring them together to write a single report. And we also write reports on behalf of other organizations in partnership with them. And then in addition, we do the technical assistance work. So if you go to our website, you'll see like an Ask Mark button. You can go there and fill out a form. So we get many requests every year from agencies, from organizations, and any nonprofits can contact us for that sort of assistance. You can read more about that on the button on our website. The group that we're part of, this national umbrella organization called the National Neighborhood Indicators Partnership. So there are groups like DataHaven in about 35 other cities in the country, mostly like large cities like Houston, Los Angeles, and Boston. But the goal of the initiative is really to collect neighborhood level information so that, even if your city is sort of improving as a whole, the conditions at a neighborhood aren't necessarily trending the same direction. So it's really important to have the neighborhood level information and be able to break down data for smaller groups so you can see which groups are doing well, which have barriers to success. And then these quotes just sort of summarize that. This slide shows an example of how you might think of indicators. So you have, typically the indicators you'll hear about in the news are things like the unemployment rate or the graduation rate. So if you're thinking about like how to achieve optimal child development, you might measure the graduation rate. It's sort of a standard indicator. It's measured the same way across the United States. So there's, a single way to measure it, and you can compare your neighborhood or your school district or your city to the national rates. But in addition to measuring that sort of outcome that you're trying to achieve, there are other measures you might consider measuring that would tie into that. So education, health, financial security. So you might measure like how much people are paying for their housing in a neighborhood. And the amount of money people pay towards housing costs can really vary. It could be 80% of some families will pay 80% of their income towards housing, whereas in other areas families pay little towards their housing and rent and utilities. So that's something you might measure. You might measure early reading scores, like how well children are adapting to preschools or to kindergarten. So that's like a second level. And then a third level, which is really important, are these structural factors. So there's like civic engagement, decision-making, racial equity. So these are like policies we have in place that maybe go back even further, like in the case of fair housing, where residents of many communities were not able to purchase homes in certain parts of the state until recently. Facilities for the disabled, so if people like really literally can't access a facility, that could have an impact. So those are like underlying factors you might also measure. Civic engagement would be things like whether parents could access the local politics or the PTA meetings and the extent to which they feel welcome at those meetings and participate. So those things would be underlying like some of the other measures sort of at a deeper level. These are just some postings of our reports on our website. You can look at our website and read through these. They're all like free to download, and a lot of folks go to the site, will download the PDF and then print them out on their own to have a copy. These are some images from the community index, which I'm passing around. So it just shows you an example of like graphics. These are some sort of key issues in the region. One is the changing household structure. So you'll see like in the greater New Haven area from 1990 to 2014, there's more and more households every year. So in other words, you need more apartments, not necessarily enough apartments for folks. People like households will double up in the same apartment, so you'll have like families living together and that sort of thing. But there's more and more households every year. And then they tend to be more single households or other like what we call non-traditional households. So the number of married households, in other words, is staying the same. So the sort of the demand for like a large, like a single family home, a place for kids, and that number's actually decreased. This is married with children. It's actually gone down from 37,000 to 31,000. but the number of other households has increased. So that just shows like differences in housing demand in the region. And then there's other charts on demographics. Aging is a big issue. There's more adults reaching their 65th birthday now. Like the rate of that has gone up about 5 times over the past decade. So there's just a lot more folks in their 60s and then 70s and 80s in the region. There's the education section. This is just an example of a chart that looks at college attainment, so degree attainment. It looks at how many residents graduated high school in the region, so broken down like for Connecticut and New Haven and the towns within the region. And then how many enrolled in college within a year, how many stayed in college for the second year, and how many eventually earned like a 2-year or 4-year degree within the 6-year period. So you can see there were about 4,000 people who graduated high school in the New Haven area in 2008. And then if you look sort of at a similar time period, about 2,000 had earned a degree within 6 years. So there are a lot of residents who go to college who don't necessarily complete the degrees, but this kind of breaks down that data for you. And if you're interested in youth programs and support for youth who are in college or thinking of going to college, as well as high school, like readiness for college, being able to take college courses, this is a good indicator to use. This is an example of economic data. So this shows where workers go in the region. And it's really 2 maps. One is showing workers who earn less than $40,000 a year at the top, and then workers who earn $40,000 or more at the bottom. So you could see every day New Haven has like a net change of the high income workers of about 33,000 workers coming in, and they're coming from all these towns. The orange towns are towns that are losing workers at a net basis. So, some people are going to Hamden for work, some people are leaving, but if you sort of take the net level, like, there's a loss of workers from pretty much all the towns around New Haven. So a lot of folks work in the city. The low-income picture is different. So what you see here is the line from New Haven. You can see that connecting to other towns. So workers who are living in New Haven who are at that like salary level, they're about 70% of them actually leave the city to find work in the surrounding towns. So there's just a difference in commuting patterns based on what types of jobs are in the suburbs versus what types of jobs are in the city, and then also where housing is and who can afford housing in different areas. The reports also, all of these reports were written in partnership with hospitals and health departments. So we've worked with most of the hospitals and health departments in the state of Connecticut to write these, and the reason is they're always doing like health needs assessments where they're looking at health conditions at a local level in their area. And because of the availability of data and working together, they could really get a lot more data about issues related to health conditions. So you'll see a lot about that in the report. This map shows preventable dental conditions. So these are conditions that are kind of like an incidence proxy for lack of dental care. So in other words, if you lack dental care, you're more likely to go to the emergency room with like an infection or a serious issue with that. And what you'll see here is like the number of people who go to the emergency room for dental issues is really, really low in a lot of areas. But then in the neighborhoods that are low-income, with a lot of low-income families, the rates can be high. And this is especially true of people in their 20s and early 30s, just a really high rate of people, maybe not able to access dental care, but then something comes up, like either an injury or tooth decay, and they end up in an emergency room. So the rates are quite different in that. And this is based on looking at like any hospital encounters in the state. So whether people went to any of the 35 hospitals in the state, it kind of maps where the residents were living at the time. There's a lot of like good news in the health data. Like these are some key findings in the community index. So you'll see the rate of people with health insurance has improved dramatically. This is the percent without health insurance. You can see it's dropped dramatically from 2012 to 2015. And then like smoking rates are going down. Life expectancy is increasing pretty quickly. Low birth weight. This is infants who are born below this kind of standard birth weight. That rate's gone down as well. And then in terms of like other chronic diseases like obesity and diabetes, some of those are tied to age. So you're seeing a rise in obesity and other issues like that. But what's interesting there is the gap. So in the wealthiest areas, the obesity rate has really stayed about the same, whereas in like rural parts of the state or sections like farther outside of the city, the rates have gone up more quickly and also have gone up in city centers. So that, to me, that's an indication of like barriers to accessing good, your full health potential. If you're in some areas, people are staying like as healthy as they were in the past by that measure, sort of diabetes and early chronic diseases like stroke and heart disease. In other areas, there are much earlier incidences of those diseases. So that's of concern. It's kind of tied to the life expectancy graph would show the same thing. If you were to plot like low-income residents versus high-income residents, you'd see high-income residents have gained a tremendous amount of life expectancy, like really living into their 90s now. And then for many groups who are like lacking college degrees or high school degrees or have low income, the life expectancy has actually declined in many cases. So you'd see that sort of difference in the life expectancy as well if you charted that. So that gives you a sense of like what's in one of the reports on our site. And it's really using many different data sources to kind of tell a story about different issues in the region. I also wanted to talk about the DataHaven Community Wellbeing Survey. So this is a program we started to collect data that wasn't not available from other sources. So, the reports, we typically look at like what's from the census and the state agencies and from local governments. But there's a lot of missing data that is not collected. Sometimes you collect data that's meant to like look at state level rates, like the amount of people who were victims of a property crime, say. You might be able to get that information at the statewide level from like a census survey. Or things like obesity and smoking rates, they're measured at a state level, but that information is not available locally. So the survey we've developed is collecting that same information at a neighborhood level throughout the state. And it was funded by about 50 organizations. These were measures we included in the survey. So we wanted like a single measure of well-being, quality of life as one measure. So this is a series of questions like from the United Kingdom's well-being survey that they collect that look at happiness, satisfaction with life, anxiety, depression, those issues. If you group those all together, you get a sense of people's like overall well-being, and it includes like their time to enjoy life and activities, like that sort of thing. So in our country, we have the census, which collects a lot of really great data, the local level data that was pretty much limited to just like income-related factors and demographic factors. So they ask you like if you have someone in your house owns a car, how much your home is worth, that sort of thing. But they don't ask about health or well-being. So our survey captures that information. And then some of the factors that go into well-being are your health status. That's important, like whether you have access to your full health potential, so whether you have good care and healthy food and environments. This is large, so the employment and food and housing security, those are part of that's whether your basic needs are met, like whether you can afford food for your family, but also employment is sort of a broader issue about whether you think your job is suited to your skill level and the kind of the reliability of your job, as well as whether you are treated well at work and given like autonomy to make decisions at work. So those are issues related to employment that also affect well-being. And then civic satisfaction. Civic satisfaction, I think of broadly like it's your relationships with other people in your family, with friends, neighbors, as well as like how well you think the government is responsive to your needs. So do you trust like the judicial system and the police and neighbors? Because it's a neighborhood survey, we also include measures of neighborhood issues like parks and public safety, like whether you feel safe in your neighborhood and whether children have like good role models. So this is about an 18-minute survey that's fielded by cell phone and landline phone, and we just basically call like everyone in Connecticut and people respond. And then the data is weighted to be representative of any city or town. And what that means is the estimates are adjusted to, like any survey that the government does, they're adjusted to be representative of the demographics in that area. So, typically with a phone survey, you'll have like more adults in their 40s, 50s responding than you will adults in their 20s. So we just in the final estimates we produce, that's all adjusted. So like people who are young responding to the survey, they're counted more to be representative of the people in their town who are that age. So the estimates from this survey are literally identical to other surveys that are done like through door-to-door data collection where like everyone responds, or through other government surveys. So this is, I'll go through like some, from like simple reporting of survey data to more complex. So this just shows like in the New Haven area kind of some health measures like food insecurity. And you could see these are the percent of all adults age 18 and over who report being food insecure, so not having food in the past year, not being able to afford food. And you can see how those rates differ by age group and other demographic factors. So this would be like a simple way to present data. You might show the overall rate in your city and then a rate for a group that you primarily serve. Like if you primarily serve young adults, you might report the rate for young adults. And then this is looking at kind of the overall happiness of the population, like the well-being measure, by commute time. So folks who are interested in like residents with long commutes might be interested in this, that it shows as people commute more than 100 minutes a day, their well-being is lower. And then the slide on the right just shows like if you break it down by income, you could see the basically getting rid of your commute is equivalent to a pretty significant raise in income in that measure. This is another one that shows kind of as well-being increases with income, as you saw in the last slide. So what this shows is the y-axis, like the scale on the left, that's the personal well-being index. So that's like grouping all these measures of well-being together. And you can see residents who are earning $15,000 a year or less, they're much lower on the scale. That's the far left there. Residents earning $100,000 or more are like close to 0.8 on the scale in general. But there's also like large differences by personal experience. So you could see even within that group of residents earning less than $15,000 a year on the far left, you'll see the residents who are food secure or working full-time or said they received all the needed health care in the past year, their level of well-being is much higher than residents who reported not having those factors. So what this basically, if you sort of break it down, you'll see like basically the other factors besides income are very important. So if you look at people who couldn't get medical care, even earning a lot more money than residents who earn very little money, their levels of well-being are reported to be a lot higher. So it kind of gives you like an overall measure that you could tie in a lot of factors to, and it's a way to kind of connect partners, like partners who might typically work on one issue. If you have a single measure that they're all working off of, they can see how their work is related to each other. This is another one. This shows like how well-being, this is actually people who are satisfied with where they live, but similar, it's how it breaks down by neighborhood. So basically the red line there are residents in the 19 most distressed zip codes in the state, so mostly in like Bridgeport, Waterbury, Hartford zip codes primarily, and their rate of being satisfied with where they live is much lower across all income groups than the residents at like very wealthy zip codes or just sort of typical zip codes in the state. So that's regardless of income, people sort of report how they feel about their neighborhoods. These are just some examples of like how we've used the data. We try to make the data available for journalists. If you know journalists writing articles, we're happy to talk to them and explain, what they might be able to report from the information. And then we also try to do a lot of events to get the data out to different groups. So this is a quick exercise for your table, but these are some kind of areas of work people do, and there are four. It kind of breaks down to four. So one is imagination. This is like people who are most interested, like most excited about thinking of new concepts and visuals and long-term plans. Reason is like people who are most interested in collecting information and then analyzing it, verifying facts, figuring out how things work, like sort of at that level. And then people who are most interested in building relationships are interested in listening to ideas, matching those up against data to understand like people's personal perspectives, and encouraging group interaction. And then people who are interested in organization are, if they had to choose between one of these 4 things, they would be most interested in kind of setting out like the timeline for problem solving step by steps, following the directions, and organizing information so it's easy to understand. So what this is useful for is thinking like if you're writing an application or a grant application, it's good to have people from each of the 4 groups to think about how that's put together. You want people who are very organized, like the information's presented. There are good timelines, logical presentation. It helps to have these different perspectives in your group. So just to get you a little bit more familiar with the information that we collect, we passed out this report, and you can keep this. You could bring this home with you. Basically it's an executive summary of the community index report. So it takes the findings from that larger book and breaks it down so it's a little easier to understand. So as you tab through this, you'll see issues that probably relate to the work that you do in communities. And you could find there's a page on education, a page on youth. So kind of find the page that is most interesting to you, and then think about which group you were part of in the last slide, like what you're most interested in, and then describe. You can answer some of these questions to the group as you go to the group at your table as you go through. Just trying to pick out one point that would relate to the information in the document.